Mr. Smith.
Hello.
I'm Loretta Parker. I'll be taking your history today. What brings you in today?
I'm having some strange, I got a strange bump that's kind of like irritating, kind of like on the right side of my pec, between my, between my armpit and my boob, on my nipple, I guess.
Alrighty. When did you first notice this?
I noticed it about a couple of months ago.
Okay, can you describe that location for me again?
It's between my armpit and my nipple.
Between your armpit and your nipple?
Yes.
Okay. A little more like closer to your armpit?
Yeah.
Okay, can you describe what that feels like? What that lump feels like?
It only hurts when I touch it.
Okay. I'm sorry to hear that you're having this issue. Okay. Does anything, I guess, make that pain better? Or I guess anything alleviate the pain?
Some ice, maybe.
Ice. Does anything make it worse or any time?
Push up, just doing regular day-to-day routine stuff, like working out and stuff. It's kind of irritating then.
Okay. Alright, are there any other symptoms that you're having?
Mm-mm. No.
Okay. Now, can you describe, is there sort of a pattern of when this bump appears or goes away? Or has it just shown up and stayed kind of prevalent?
Well, I noticed it 2 months ago, and then now it feels like it's getting bigger.
Oh, okay. Goodness, I'm so sorry.
That's why I decided to come in.
So it's getting bigger. About what size is it?
I'd say it's about as big as it was when I found it. It was the size of a dime, and now it's probably as big as a nickel.
So it was about a dime 2 months ago?
Yeah.
I'm so sorry. Have you ever had anything like this before?
No, never.
Alrighty. Mr. Smith, I'm going to ask you just some general symptoms about your overall well-being. Have you noticed a fever?
No.
What about fatigue?
No.
Chills?
Mm-mm.
What about just an overall sense of being ill?
No.
No? What about weakness?
Uh-uh.
Okay. What about any appetite changes?
No.
What about weight changes?
No.
Okay. Alrighty. I'll ask you some questions about your pectoral area. Have you noticed any asymmetry between the sizes?
No.
Okay. Have you had any other breast pain aside from where that lump is?
Nope.
Okay. And then that pain that you were feeling with it, can you rate that on maybe a scale of 1 to 10?
Probably a 4.
A 4 out of 10. And is that pain there all the time?
Not really. It gets more irritating when I actually push around in the area.
Okay. Have you noticed any changes in color or temperature of your pecs?
No.
Pectoral region?
No.
No. Have you noticed any, it's called gynecomastia, just kind of where you feel like you're starting to develop breasts like a female?
No.
No? Okay. Have you noticed any nipple bleeding?
No.
What about any discharge from your nipples?
No.
No? Okay, and we already talked about that you do have a mass. What about itching?
No.
You're not itching more than usual? Have you noticed any changes in skin texture?
Yes.
Yes? How does that texture change?
No, it's just different.
Can you describe that?
Instead of like soft, it feels kind of rubbery.
Your skin overall is
Yeah, in that area, yeah.
How long have you noticed the rubbery texture change?
Probably this past week.
Is that in the whole area or just where the lump is?
Just where the lump is.
Okay, and then any overall tenderness?
Yeah, it's pretty tender
The
overall.
whole area?
Yeah.
Whole pec? Okay.
Yeah.
Now you pointed to your right pec. That's where all of the symptoms are arising from?
Correct.
Okay, it's not on both?
No, just right.
Okay. Alrighty. I'm going to ask you a few questions just pertaining to you and your health history. Do you have a history of hypertension?
No.
What about high cholesterol?
No, no.
Diabetes?
No.
Heart disease?
No.
Heart attack?
No.
Stroke?
No.
Or cancer?
No.
Alrighty. Are you allergic to anything?
I don't think so.
Okay. What medications are you currently taking?
Ibuprofen and some melatonin.
Okay. What's that dosage of ibuprofen?
800 milligrams a day.
You're just taking 800 milligrams a day? Why are you taking it?
I got a bum knee.
Sorry to hear that. And that knee causes you pain?
Sometimes.
That's the only time you take is when the knee's flaring up?
Yep.
Okay. And then what's your dosage of melatonin?
I take 3 milligrams
3 milligrams every night
every night.
to help sleep?
Mm-hmm.
Okay. How long have you been taking that ibuprofen?
Probably since, probably for the past couple of years.
Okay.
Yeah.
Alrighty. You ever been hospitalized?
No.
You ever had any surgeries?
No.
Are you up to date on all of your immunizations?
I am.
When was your last flu shot?
Back in January.
January 2020?
Yep.
Alrighty. I'm going to ask you a few questions based on your family history. So this kind of pertains to any parents, siblings, or children that you have.
Okay.
Are both of your parents still living?
One of them is.
Okay. Your mother or your father?
My mother's still living.
How old is she?
She is 63.
Alrighty. And your father is deceased. When did he pass away?
Probably about 10 years ago.
How old was he?
He was probably 50.
Okay. How did he pass away?
He was driving his motorcycle in a motorcycle accident.
I'm so sorry to hear that. Do you have any siblings?
No.
Any children?
No.
Alrighty. So pertaining to your parents, even though your father's no longer with us, any history of hypertension?
No.
What about high cholesterol?
No.
Diabetes? Heart disease?
No.
Heart attack?
No.
Stroke?
No.
About cancer?
Yes.
Okay, which one had cancer?
Mother had cancer.
Okay, what kind of cancer did
She had breast cancer.
Okay. How old was she?
40.
Alrighty. Any history of tobacco usage?
No.
You ever been exposed to secondhand smoke or anything like that?
No, ma'am.
Never done any tobacco products?
No.
Okay. How much alcohol do you consume?
I drink probably 3 or 4 beers a day.
Okay. Recommend that you might want to cut that back a little bit.
Okay.
Too much alcohol consumption in excess isn't good for anybody. Do you use recreational drugs?
Yes.
Okay. What recreational drugs are you using?
I do a little pot. Smoke a little pot.
Define a little pot for me, please, sir.
I guess maybe an ounce over the weekend, maybe. You know, just kind of party with the bros.
Okay. So here in the state of Louisiana, that is not legal. So I'm going to advise you against that from now on. But I can also not tell you how to live your life. Also, that pot, are you smoking it?
Yes.
Okay, so you have been smoking. Okay.
Pot.
So you do smoke.
Marijuana.
Still smoke exposure to the lungs though?
Yeah.
Okay. How often have you been doing this 1 ounce a day with the bros?
Not 1 ounce a day. Like,
or 1 ounce a week?
maybe an ounce would last maybe a week.
Okay. How long you been doing that?
I've been smoking probably for the past 12 years. Just recreationally.
Okay. Since you were about 16, okay. What is your living situation like?
Still live with my mom.
You feel safe at home?
I do.
What's your diet like?
Well, I eat really healthy actually.
Okay, can you define what healthy is?
I eat my protein, I eat my veggies.
Okay, a good amount?
Yes.
Avoiding the junk food?
Correct.
What about your exercise?
I work out probably 6 times a week.
What do you do when you work out?
It depends. Upper body, lower body. I got a schedule.
Is it like lifting weights?
Lifting weights and cardio on certain days.
Where are you employed at?
I'm employed at the local brewery here. I work at what's that place called?
Okay. Do you feel you can afford your health care or financially?
Yeah.
Okay.
Mom will pay for it.
Do you have insurance?
No.
Finally, are you sexually active?
Yes.
Yes. Do you have multiple partners?
Just one.
Just one. Are you using protection?
Yes.
What kind of protection?
I think she's on the bill.
Okay, definitely double check. All right, Mr. Smith, we'll get you all taken care
All
of.
right,
Thank
thank
you
you.
so much.